Welcome back to our channel. Did you know that over 100,000 Americans start dialysis each year due to high creatinine levels leading to kidney failure? This staggering number could include anyone, but don't worry, our latest video, 5 simple daily habits to quickly lower creatinine levels and avoid dialysis, offers a ray of hope. Learn how these 5 easy-to-implement daily habits can significantly lower your creatinine levels, enhancing your kidney health. Imagine the relief of avoiding dialysis and enjoying a life full of energy. These habits are practical, scientifically backed, and can easily become part of your daily routine, giving you a chance to prevent the serious consequence of kidney failure. Watch our inspiring video now and take the first step towards optimal kidney health. Your proactive efforts today can pave the way for a healthier future. Your kidneys will thank you. 1. Reduce protein intake. Reducing protein intake, especially from sources like red meat and dairy products, can significantly benefit kidney health. This doesn't necessarily mean adopting a completely vegan or vegetarian diet, although these are healthy options. The key is to be mindful of the type and amount of protein consumed. Red meat and dairy are high in specific proteins that, when metabolized, produce more creatinine, a waste product filtered by the kidneys. Consuming these protein sources in large quantities can temporarily increase creatinine levels, adding strain on the kidneys to filter this excess. Scientific studies have shown that a diet lower in protein, particularly from animal sources, can be beneficial for individuals with kidney issues or those at risk. This is because a lower protein diet reduces the kidney's workload, thereby slowing the progression of kidney disease and improving overall kidney function. This doesn't mean eliminating protein entirely, as it is essential for various bodily functions. Instead, the focus should be on carefully selecting the sources and amounts of protein. To support kidney health effectively, consider a balanced approach by incorporating leaner protein sources like chicken and plant-based options. Dr. Georgina Barbara Piccoli and her colleagues have extensively studied the role of protein intake in the management of chronic kidney disease, CKD. They emphasize that while reducing protein intake can help control the progression of CKD, it is crucial to balance the quantity and quality of proteins consumed. A key focus of their research is the potential benefits of plant-based proteins over animal proteins. One of the significant findings is that plant-based diets, which are typically lower in phosphorus and produce fewer acidic byproducts, can help reduce the strain on kidneys. This is particularly important because excessive phosphorus and acid can exacerbate CKD symptoms and contribute to bone disease, acidosis, and cardiovascular issues. Plant-based proteins found in foods like beans, lentils, nuts, seeds, and soy products are associated with a lower risk of renal dysfunction and slower progression of kidney impairment. Dr. Piccoli's work also addresses the challenge of maintaining adequate nutrition, particularly in older adults with CKD. In this population, there is a delicate balance between preventing malnutrition and managing protein intake to slow CKD progression. The research suggests that in cases of stable kidney function and the absence of malnutrition, a carefully monitored low-protein diet can be beneficial. However, if there is a risk of protein energy wasting, PEW, protein intake should not be overly restricted, and individual patient needs and preferences should guide dietary decisions. Moderate consumption of chicken, around 2 to 3 servings per week, is ideal. Each serving should be approximately 3 to 4 ounces, 85 to 113 grams, which is about the size of a deck of cards. This provides adequate protein without overburdening the kidneys. Additionally, including plant-based proteins in your diet can be highly beneficial. Options such as vegan chicken patties are not only delicious and satisfying, but also easier to digest. These plant-based alternatives have a minimal impact on creatinine levels, making them an excellent choice for maintaining healthy kidney function. 2. Drink water. Maintaining adequate hydration is a simple yet powerful way to support kidney health. Rather than strictly adhering to the popular recommendation of consuming half your body weight in ounces of water daily, a more tailored approach is advised. According to the Institute of Medicine, men should aim for approximately 3.7 liters, about 125 ounces, of water per day, while women should target around 2.7 liters, about 91 ounces. This includes all beverages and moisture-rich foods consumed throughout the day. Water plays a crucial role in helping the kidneys filter and eliminate waste products and toxins from the bloodstream, which are then processed into urine. Proper hydration facilitates these functions and helps prevent the formation of kidney stones by diluting substances in the urine that can lead to crystallization and stone formation. Additionally, adequate water intake has been linked to a reduced risk of chronic kidney disease and can help slow the progression of existing kidney conditions. Proper hydration also aids in maintaining electrolyte balance, which is essential for various bodily functions, including nerve and muscle operations. Dehydration can lead to concentrated urine, increasing the likelihood of kidney stones and urinary tract infections. Therefore, ensuring an adequate and consistent intake of water is critical, especially for those at risk of or currently managing chronic kidney disease, CKD. However, individuals with specific kidney conditions, particularly those with advanced CKD or on dialysis, may need to carefully monitor and possibly limit their water intake to prevent complications such as fluid overload. It's important for these individuals to consult with healthcare professionals to determine the appropriate amount of water intake based on their specific health needs. Moreover, individual water needs can vary based on several factors, such as environmental conditions, physical activity levels, and overall health status. For example, in hotter climates or during intense exercise, the body loses more water through sweat, necessitating increased fluid intake. Conversely, in cooler climates or during periods of low activity, water needs may be lower. For those with specific kidney issues, it is essential to consult healthcare providers to determine the most appropriate level of hydration, as certain conditions may require adjustments to typical fluid intake. This personalized approach ensures that hydration supports not only kidney function, but also overall well-being. 3. No vigorous exercise. For individuals with chronic kidney disease, CKD, engaging in less intense physical activities can be beneficial. Vigorous exercises like heavy weightlifting, fast running, or long-distance marathons may increase the risk of temporarily elevated creatinine levels, which can strain the kidneys. This elevation in creatinine is typically short-lived, lasting only a couple of days, but frequent spikes could potentially strain kidney function over time. Instead, it's recommended to focus on gentler activities such as brisk walking, swimming, or light aerobics, which are easier on the kidneys and can help maintain overall fitness. The National Kidney Foundation recommends that patients with chronic kidney disease, CKD, engage in at least 30 minutes of moderate exercise per session, 3 times a week. Ideal activities include walking, cycling, and low-intensity aerobics, which help keep the heart rate within the optimal range of 100 to 120 beats per minute. This moderate intensity is key for reaping the benefits of exercise without placing undue stress on the kidneys. Instead of heavy lifting, which can be strenuous on the kidneys, it is advised to focus on exercises that involve continuous movement of large muscle groups. This approach not only improves muscle strength and cardiovascular health, but also enhances overall well-being while minimizing the risk of overloading the kidneys. Prioritizing these types of activities helps CKD patients maintain their fitness safely and effectively. The rationale behind this recommendation is that intense exercise can cause a temporary increase in creatinine levels in the blood, indicating added stress on the kidneys. This elevation in creatinine is typically short-lived, lasting only a couple of days, but frequent spikes could potentially strain kidney function over time. By choosing less intense forms of exercise, you can help maintain stable creatinine levels, which is important for overall kidney health. Additionally, CKD patients should be mindful of symptoms such as fatigue, joint pain, or any discomfort during exercise. Consulting with healthcare professionals before starting a new exercise regimen is crucial, as they can tailor the program program to individual needs and limitations. This personalized approach ensures safety and maximizes the benefits of physical activity. Incorporating these practices helps maintain kidney health while allowing for regular physical activity, which is essential for overall health management. For more detailed guidance, it is recommended to consult with healthcare providers or specialized kidney health resources. 4. Eat more fiber. Increasing dietary fiber is an essential strategy for improving kidney health. Fiber is beneficial not only for digestive health, but also for its role in managing blood sugar levels, reducing blood pressure, and potentially slowing the progression of chronic kidney disease, CKD. High fiber foods such as fruits, vegetables, whole grains, and legumes help reduce inflammation and promote a healthy gut microbiome, which can benefit overall kidney function. Fiber helps by binding to waste products and toxins in the digestive tract, aiding in their elimination and thus reducing the burden on the kidneys. For instance, soluble fiber can help lower cholesterol levels and regulate blood glucose, crucial for individuals with CKD who may have diabetes or other metabolic disorders. The recommended daily intake of fiber for adults is between 22 to 34 grams, depending on age and gender. This intake can be achieved through a diet rich in plant-based foods. For those who find it challenging to consume enough fiber through food alone, supplements like Benefiber can be a convenient option. These supplements can be easily added to meals and beverages, providing an additional 4 to 8 grams of fiber per serving without affecting taste or texture. It's important to consult with a healthcare provider before making significant dietary changes, especially for individuals with CKD, as certain high-fiber foods may also be high in potassium or phosphorus, which need to be managed carefully in kidney disease. 5. No supplements. For individuals concerned about kidney health, particularly those with pre-existing kidney conditions, avoiding creatine supplements is advisable. Creatine, commonly used for enhancing muscle strength and performance, is converted into creatinine in the body, a waste product filtered out by the kidneys. While creatine can be beneficial for athletes, excessive intake may elevate creatinine levels, potentially indicating kidney strain. Research from the Mayo Clinic and Cleveland Clinic highlights that creatine supplements can increase muscle mass and aid in short bursts of intense exercise, but they may pose risks for people with impaired kidney function. High creatinine levels can strain the kidneys, leading to complications such as dehydration, muscle cramps, and potentially more serious issues like rhabdomyolysis, the breakdown of muscle tissue, and sudden kidney failure. This is particularly concerning when creatine is taken in high doses or combined with other substances like caffeine, which may exacerbate the risk of dehydration and kidney damage. Mount Sinai Health System also notes that creatine should be used cautiously, especially by those with existing kidney issues or taking medications that affect kidney function. The U.S. Food and Drug Administration, FDA, advises consulting a healthcare provider before starting any creatine supplementation, as not all products are regulated and contamination risks exist. For optimal kidney health, individuals should prioritize a balanced diet and exercise routine, and avoid supplements that could impose additional strain on the kidneys. Always consult with a healthcare professional before introducing any new supplements into your regimen. Which of these habits do you think you'll implement? And do you have any personal tips or strategies that have been effective in supporting your kidney health? We hope these practical tips have been insightful and helpful in your journey toward better kidney health. By adopting these habits, you can significantly improve your overall well-being and potentially prevent the serious consequences of kidney disease. Reducing protein intake, staying adequately hydrated, engaging in moderate exercise, increasing dietary fiber, and avoiding certain supplements like creatine are all effective strategies backed by scientific research. These simple changes can make a big difference in maintaining healthy kidney function and preventing further complications. Remember, it's crucial to consult with healthcare professionals before making any significant changes to your diet or lifestyle, especially if you have existing health conditions. Your proactive efforts today can lead to a healthier tomorrow, offering a better quality of life. Don't forget to like, share, and subscribe to our channel for more health tips and valuable information. Thanks for watching and see you in our next video.